Okay. For the benefit, make sure that you have your first and last name capitalized. And then this is a jigsaw activity. Does anybody know what jigsaw means? Does anybody know what jigsaw means? Basically, it means you're going to split into groups and you're each going to do a part of it, and then you're going to get together and share information and make sure you understand. So I'm going to give you guys a quick minute. Ethan and Sean, can you do the first three? Ron, is anyone sitting at your table with you? Okay, Ron, can you do the next two? Mario and, I'm sorry, what was your name? Gerardo? Mm-hmm. You're going to do the last three.
Still three coming in.
Gerardo with a G?
Yes, ma'am.
Okay, and then whenever Jordan and them get back, we got Jordan. I don't remember, it's Caesar Auna, I think, or Acuna. And I don't know the other guy. I think it was Max. Okay, I'm going to take attendance for myself because I have to keep track of who's here in person and who's not. And then after that, I can focus on whatever else we're doing. But that's what I would like you guys to do. So I'm recording this for our online kids. All right, Ethan and Sean, tell me anything you know about copay, coverage limits, and deductibles. Can you explain what it is, even if maybe you can't make it a simple definition? What's a copay?
A payment made by a beneficiary in addition to that made by an insurer.
True. Do you know what that means?
It means that you have to pay and they pay.
True. How many of you guys have ever been to a doctor before? Do your parents ever go up and pay? So a copay is what you pay.
Oh, yeah. This is what your insurance is.
Uh-huh. When you visit the doctor. So usually it's around $15 to $20. That's a typical copay amount. Let me see if I can get this to suck less. It's like really blurry. There we go. That's better, right? I know, every time I stand up it turns off, but it comes back. Don't ask me why. It's like... Okay, what's a coverage limit?
It's how much your insurance will cover the payment.
Yeah, so usually this is either a dollar amount or a percentage. It's what the insurance will pay. I'm going to say it's usually a percent or a set dollar amount. So for example, if I go to the doctor, 80% of my bill is paid by my insurance, but if I go to glasses, if I go get vision care, they have a limit of $150 on my frames and like $120 on my lenses. So depending on what kind of care it is, on which one it's going to be. What's a deductible?
The amount that you have to pay before they do anything.
Yes. So this is what you pay. Before insurance helps. This is a really important thing. When I got my first job that had medical insurance, I didn't know what any of this crap meant. And I was super overwhelmed because they're like, here's 4 different plans. Which one do you want? And I was like, I don't know. I don't know what any of this means. Help me. Do you need me to pause for a second so you can write all that down? We'll pause. All right, Ron, which one did you do? Did you do elective medical procedure or emergency room?
Both.
You did both? What about you, Hiram? Which one do you have?
I'll take the first one.
You'll take the first one? Will you wear your mask, please? Thank you. What's an elective medical procedure?
Is the surgery that's scheduled ahead of time?
Kind of. I see what you're saying because you planned for it, right? Yes. So this is dependent on your insurance. They decide what they will cover and what they won't cover. So example, I have bad vision. If I wanted to get LASIK surgery, that's not covered. It's considered elective. So it's what insurance deems unnecessary. An example, I'm going to say LASIK surgery. So for example, usually it's not life-threatening if you don't get it, but you don't have to have this word for word. You just need to be able to recognize it. Ron, what's the emergency room?
It's a department of the hospital that provides immediate treatment for acute illnesses and trauma.
Mm-hmm. So it's at the hospital. For immediate medical care. It's usually for something life-threatening. That's what it's designed for. All right, I see 3 or 4 people with headphones in. If you would please take them out during the lesson. I don't mind if you listen to them during your assignment time, but during the lesson where we're working together, I just want you to be able to hear us. Caesar, Max, Jordan, and Jerry. Jerry's like, what? You came in late, so I'll add you to the list. Help us out. Who wants to do in-network? Who wants to do medical necessity? And who wants to do out-of-network? Max, which one are you?
Out of network.
Which one?
Out of network.
Out of network. Go, Max.
Healthcare provider does not have contracts with your healthcare health insurance plan.
Okay, a doctor? That is not contracted with your insurance. What does that mean? What does it mean if the doctor isn't under contract with your insurance? Basically, you don't get paid, you have to pay for it yourself. You pay.
So plastic surgery.
Well, it could be anything. So, for example, they'll have a list of family doctors that you can go to. And if I went to a different family doctor that wasn't on that list, they won't pay for it. So even though it's like a medical necessity, it's a no. All right, Jordan, which one are you going to give us? And Caesar, which one are you going to give us?
All the medical necessities.
Okay, talk to me. What's a medical necessity?
Healthcare services that a physician would provide to a patient. Diagnosing or treating illness or injury.
Can we make that simpler?
The things a physician has would do if you were like, if you went in for treatment.
Okay, so basically, a medical necessity is anything, any treatment needed to maintain usually life and quality of life. You guys, am I gonna die without my glasses? I mean, I'm pretty blind. Check this out. I don't know if you can see. Can you see?
I mean, if you drive without them,
I can't drive without these. It's illegal. Plus, I'd die. I'd crash into things. I'm not going to die without my glasses, but is my quality of life the same if I can't see? No. Okay, so they look at the least expensive option to give you a reasonable quality of life. Caesar and Jerry, what does in-network mean? Good morning. You need just that paper, and you're going to sit here. Grab you a chair and pull it up. Guys, if we know what out of network is, what is in network?
a
A doctor that's contracted. The insurance pays. Yay! All right, we're to premium and urgent care, and we're coming back to Mario and to Gerardo. So Mario and Gerardo. I don't care who goes first or which one you do.
Premium is the amount that needs to be paid for an insurance policy.
Mm-hmm. So this is what you're going to be paying every month. Usually it comes directly out of your paycheck towards your insurance. It's what you pay to have insurance. Is that a simpler way? Is that understandable? Okay, so for example, my medical insurance, we'll talk about that actually in a minute. But I typically pay about $25 a month, I think. My other insurance, like my car and my home and stuff, is like $116. I know that altogether my home, my car, my property insurance is $116. But the medical, honestly, don't remember. Okay, Mario, what do you got for urgent care? What's urgent care?
Department where you're taking, like, you get a shot or something?
Kind of. Have you guys ever had an accident that you needed stitches from? Where did you go to get the stitches? You can go to your doctor, but most of the time the doctor will make you wait a little bit because they don't have appointments open. How much does it cost to go to an emergency room? It's really expensive. And urgent care is basically an emergency room during daylight office hours. So this is a place, a doctor's office, to get immediate assistance with it cannot be life-threatening. If it's life-threatening, they send you to the emergency room. Non-life-threatening issues. Can I just say issues? Okay, very short story. I was 18. I went to college. I was living in a house with some roommates. My roommate sliced her hand open, like all the way to the bone. Follow me? How? A knife. She had a little clumsy moment. I had to drive her to the ER. Guess how much it cost for the stitches once everything was done? She got 3 stitches right here. 1, 2, 3. We were sitting in the ER for 2 hours before they even got to us. Guess how much that cost? $1,500. $1,500, and that was like 15 years ago, you guys. $1,500. About 5 years ago, I dropped a knife on my 5 years ago, I dropped a knife on my foot and I had to get stitches, 3 stitches too, but it was on my foot. Guess how much that cost? Guess how much that cost, y'all? Please set that table right there. You need this paper? That table right there. Guys, I went to urgent care instead of the ER. Guess how much it cost? $50. That's it. Cost me $50. I went, I paid my urgent care fee. So which one do you want to go to? Yeah, if you need to go to urgent care. Emergency room is only if you're dying. Follow me? Okay. All right, so now this is what we got. Hey, listen. We're about to break into groups, and you guys are going to work individually, and then we're going to jigsaw. So how a jigsaw works. You guys ever have too many problems on your homework, and you each take one, and then you share answers? That's what we're doing. Okay, but instead of just telling them the answers, you got to be able to explain it. So there's 3 types of healthcare. Anybody know any kind of healthcare that you've ever heard of?
Obamacare?
Okay, yeah, let's do Obama here. Okay, Obamacare counts as one. Flip. I'm going to call it private insurance.
Oh, isn't Obamacare like the government assistance?
Yes, exactly. So this one's private insurance.
Oh, is there just one that is no?
There's 3 types. There's 3 main types that I've ever heard of.
Is it like you don't actually use it, or it's not actually a thing though?
I don't know what you're talking about.
Like you said you did it before.
HSA.
Yeah, that.
Yep, that's the last one I'm going to do. Can I go down? And the 3rd type is HSA, which is health. It stands for health savings account. Okay, we've got 2, 4, 6, 12, 13 people and 3. So I need 3 people on each one with one group of 4. So quietly raise your hand if you want to do Obamacare. If you don't pick one, I assign you one. All right. Anybody want to do Obamacare? Anybody want to do private? Want to look up what private is? Anybody want to do HSA? Nobody wants to do anything? Okay, so I'll just assign you. Jerry, Caesar, Ron, and Hiram. So the first 2, you guys right there, you guys are going to be Obamacare. You're going to look up and figure out what it is. You're going to figure out how it works. And you're going to have to be able to explain. There should be 3 things you're telling me. I want to know about, hey guys, listen. For every single one of these, I want to know about the deductible. I want to know about providers. So I want to know if they have a list of in-network, out-of-network. Right? I want to know what it's going to cost me out of pocket. So like Copay. I want to know what this looks like for me. You follow me? Okay, so for each one of these, I want to know that. Okay, private insurance. Tell me your name. I want to say Miguel.
Yeah.
Miguel and Sean and Ethan. Sean and Ethan. You 3 are private insurance. Okay. Mario. Oh, you okay? Mario and Miguel? You guys are going to be private insurance too. Okay, you guys, front 4. You are all together on the HSA. So we've got Jordan. We've got Max. We've got Torres. Gabriel? And I don't remember. I'm sorry. Gerardo. Okay. I'm going to give you guys about 10 minutes to work on that. I'm happy to help you. I'm happy to give you feedback. I'm going to pause this so that the video's not the whole freaking time. As soon as I figure out where my cursor is. There we go. Let's start with our HSA. It's okay if you don't have everything right now. Tell me what you know about it.
It boosts your retirement.
That is my favorite part about it, is it boosts your retirement. Do you guys know how it boosts your retirement? Here's the deal. I'll explain what an HSA is in a minute if they don't cover it. So I got your back if you don't got it. But what do you got? What else do you know about HSA?
It's your own portable account.
Pardon?
It's your own. It's
Yeah.
Your own portable account.
It's yours. It's your own account. Jordan, what do you want to share?
Oh,
They keep stealing yours?
yeah.
Max is laughing, but Max is next, so.
Yeah. High tax deductible.
So
What would that go under?
it's tax deductible. It's actually, I would say it's pre-tax. Okay? Max, what do you know about an HSA? Anything. It could go in a key point or it could go here.
They call them the fees,
Explain.
like the money you pay. I don't know what it is.
I'm going to say it has a higher deductible. You guys, what is a deductible? Who remembers what a deductible is?
Hey,
What you pay when? Before your insurance helps. That's a lot, right? Okay. So I'm going to summarize what an HSA is. So an HSA, it can either be used alone or with a private insurance together. I typically use it alone because that's the options I was given. An HSA allows you, instead of you paying every month into an insurance that you never get that money back, it's a savings account that you pay into for medical expenses. You pay in, so it's really helpful for two separate reasons. One, what you put in. What you put in is subtracted from your income before taxes are calculated. So if I put in 10 grand, that's 10 grand less that the government is taxing me on. Does that make sense? Okay, so what you put in is subtracted from your income before taxes are calculated. The next thing I love about it is you can spend it on anything medical related. So there's a lot of rules on what you can do with your provider. So a lot of them won't cover chiropractic. They won't cover going to the store and picking up the medicine, like your allergy medicine or anything like that. You can get anything medical related using this. So it covers any medical expense. Now I will say that there are cons. In the state of Texas, let me just look it up. HSA limit 221, sorry, Texas. Okay, so there's a limit of this much, 3,600 per year. So if it's going to cost you more than that, like if you have some kind of medical emergency, this is the most you can have in your account in a year pre-tax. Anything over that, they tax you for. So that's lame, right? Okay, now here's the deal. If you put this much in and you don't use it, it's still there for you next year. And if you can keep doing this, and this is how you can build your retirement. Because you can keep that money in there to use for any medical expenses you have ever, including when you're older. And most of the time, you don't have a lot of medical expenses when you're young, but you do when you're older, right? Okay, so that's awesome. Another con is, I'm trying to think. Savings, there's a limit of this. So you're paying all your bills. None of it's covered by insurance. Now I'm going to put a note on here. It depends on the plan. Some will be a hybrid where you have a high deductible and you have an HSA and you still have a provider and they can negotiate you better prices and that kind of stuff. Dustin, I need you to wear your mask. Thank you. Okay, we're going to go over to private insurance next. So let's start with the two Miguels and Omar, because they are the ones who haven't participated yet. You need a minute?
No, I know what I'm doing.
Okay, so you're finding out what private insurance is, how it works. Yeah, search it up. Find out what a private insurance is and what it means. This, Miguel Sosa, what do you know?
High cost.
High cost. So a con is you pay every month. Even if you don't use it. And you never get that money back. Does that make sense? Okay. We'll come back to it. Omar and Miguel will give you a few minutes to try to find some more things. That Miguel. We'll give you a minute. I'll press pause. All right, guys. Let's come back together. Omar, you said you had something?
Yeah.
What do you got?
So it has, if you're in the hospital, it has decreased playtime.
That's a pro.
Yeah, so,
Okay. Preferential help at hospitals. Miguel.
I think most health insurance policies don't offer coverage for all types of diseases and conditions. I think the con.
I don't actually know what you said.
I think most health insurances policies don't offer coverage for all types of diseases and conditions.
Okay, so limited coverage. Absolutely. What's a pro? Why would we ever go with private insurance then?
You can choose your own doctor.
Most of the time, you can choose your own doctor. I'm going to say in network. But they usually have hundreds of doctors in network that you can choose from. Okay? Why would I ever pay for this if the health savings account is my money and I just keep it and I only use it if I need to? Why would I ever pay for this? Why is private insurance even invented? Nope. It was actually invented by working people. Put it away. I see 3 phones. Put them away. Use your brain. Pardon? Actually, HSA has more freedom. Guys, what's the most I can put in my HSA account?
3,600.
How much does a heart transplant cost? Google it up.
Let's just say it's smarter to go to Canada or Italy, become a citizen there to get on it.
Okay.
Canada, well, you could die by the time you become a citizen.
I want to go citizenship. 400 now.
How much does a heart transplant cost right now?
That's a kidney transplant.
1.4 million.
Shh. Wow, right? Is that not, guys? Who can afford that?
You call it right here.
Nobody really, right? You guys, I'm tired of talking over the side. That's not acceptable. Phones away. I don't want to see them. I see them. They're mine. So I don't even want to see it. Put it out of your hand. Put it in your pocket. Not on the table. Out of sight. I'm talking to you, Torres. Don't want to see it, Jerry. I know it's just part of your phone, but put it away. I don't care where it goes. I just don't want to see it at all. Thank you. Okay. A major pro here is once your deductible is reached, so once you pay your deductible, they cover everything.
Even the heart transplant.
Uh-huh. If it's deemed medically necessary, do you need it to survive? Then they have to pay.
Could you add your timeline? Could you add your time?
They have to pay 100%. Okay, one of the cons is limited doctor choice. So how this HSA, I'm not HSA, sorry. How your private, how, am I going too fast? Okay, how your private insurance works is basically you pay a monthly fee. It can be monthly, it can be annual, doesn't matter, to have coverage. So that's just to get you in the program. That's like your car insurance, right? You pay every month to have your car insurance. Okay, next what happens is you can visit doctors, except where you pay a copay up to your deductible. Come in. It's not open. I mean, it is open. It's locked. It's not locked, honey. Come in. Yes, Miss Lopez.
These are sketches that came from University High.
Okay.
Miss Barnett said,
Would you like me to hand them out?
the ones you can.
Okay, I will do my best. I will do my best.
Yeah. Okay?
Oh,
Thanks.
algebra and financial math. Yes, no problem. Okay. Once you pay your deductible, insurance covers everything after that. Now I'm going to put a note in here that it has to be medically necessary. They cover 100% after that. So if you're in really good health and you don't have any accidents, an HSA is better because you get all of your money back. Does that make sense? But if you have, if anything crazy happens, a private insurance is better. Because I don't know about you, but I don't have 1.4 million for a heart transplant. I don't have 400,000 for a kidney transplant. I don't have money for that. Do you guys have money for that? Dustin, mask. Okay, flip the page. We're going back to the beginning. Talk to us about Obamacare. This is the one I know the least about. Okay, Jerry, you're the one who hasn't shared yet. So, Jerry, Obamacare, you're up. Shh.
I know prescription drugs cost less as a pro.
That is definitely true.
Health insurance is more affordable for people.
Yes, for one, that's it.
I don't care.
Omar, I don't need your help.
Métetelo away.
What was your other one?
Health insurance is more affordable for people.
Yeah, it's definitely more affordable. More affordable, okay? Dustin, what's one you can share?
I just been bouncing. I ain't done Obamacare yet.
Oh, you haven't? That was the one you were assigned, babe. Oh, that's why I put Hiram instead of Dustin. That's my bad. Ron, what do you got?
Many people have to pay higher premium.
What's a premium?
What you pay to have insurance?
Okay, so that's a con. Okay, who's eligible for Obamacare?
Yeah, that's crazy. That's crazy, Jerry.
Wow.
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 You're lucky there's somebody here.
Jerry, I think you owe me 10.
Come on now, Jerry.
Okay, can we take a deep breath or do we need to step in the hall again, Jerry? Deep breath, deep breath. And put your phone case away. Okay. How do you qualify for Obamacare? Oh my gosh.
You gotta be a citizen.
You do have to be a citizen. Let me search it up real quick.
I think you have to be making a certain amount. Like below certain amount.
Guys, that's not acceptable. The side care. The side.
Someone called for it, Jerry.
Did you record that?
Yeah. That's recorded for time and all things. Nope.
Can we see it in cameras?
Yeah, it'll be there as soon as I'm done recording and I upload it. Am I crazy or did this go like black and white weirdness?
It's getting worse, man.
Yeah, but it's changed. Something's wrong. Like the settings are wrong. Guys, okay, so here's what I know. Obamacare usually costs, okay, I think it's a higher premium. It's about $411 a month is what Google is telling me. That's the average. That's a lot to be paying for your medical insurance, right?
So, was it private insurance expensive?
Private insurance costs me, well, I do my HSA and I do private, and I think it's about $25 a month. It might be as much as $75 a month. Jerry, step out. You can come back when you get yourself under control. Okay, so how this works, typically to apply for Obamacare, you have to be unemployed or you have to be low income, which works for pretty much anyone who's just graduating from high school because y'all aren't going to make that much at your first jobs, right? And you got to enroll during open enrollment.
If it's more affordable, how is it more affordable if that's a
It's more affordable than having to pay for stuff out of pocket that you can't afford. And this amount depends on how much you make. How much you're spending, how much you pay each month depends on how much you make.
Oh, okay, so it's not actually.
No, that's the average. Okay, I'm gonna say a pro is you get to select a plan. So they have multiple plan options.
And Obamacare would fall under government assistance?
Yes, this would count as government assistance. I'm going to tell you right now, a con is the amount of paperwork. I was in college and I was on, I think it was Medicare or Medicaid when I was in college. They didn't have Obamacare yet because Obama wasn't president yet because I'm that old. But because of that, the amount of paperwork you had to do every single time, I'm talking 10 pages of paper every flipping time I visited the doctor. It was insane. I'm also going to say it was harder to keep track of medical procedures. So what I mean by this is when you go to your doctor now, you're probably attending a primary physician or a family care doctor. They have all of your medical history right there. They have track of all of your immunizations, all of your shots, every time you've broken a finger, had stitches, any kind of medical attention that you've received. They have a record of it all. When you're on Medicare or healthcare or Obamacare and you're not seeing the same doctor every time, because usually you're not, you have to keep track of that yourself, and you have to update your doctor every time you go to see a new doctor. You have to give them your entire medical history every time, or they could do something that they could give you a medicine you're allergic to, etc. But if they don't have that medical history, they can't make accurate diagnosis. So this was a real pain in the butt. Okay. This, I will do some more research on to figure out how to explain the difference between this and private insurance, but they definitely, a pro is you can see any doctor.
Wait, could you also see any doctor with HSA?
Yes. So it says all U.S. doctors can be seen. So you can see any U.S. doctor. I'm gonna note that they only cover medical necessities. Okay. When you have that completely filled out, you are going to use it to do, there's a crossword online. I need you to do that crossword and then turn it in. It's not allowing me to assign points or due dates, but everything that we do is always due by Friday. I'm going to have it automatically take points off when you turn stuff in late because I'm all done with this. Let me wait till the last day and try to pass. No, you wait that long, you will not pass.
You said the crossword or the jigsaw?
It should be under the same module.
So both of them are?
Both. Health insurance crossword should be there. And then the one before that is what we just did. So you don't need to turn this in online. You're going to take a picture and turn it in, but it won't let me do that yet. So if you want me to hold on to it, you can turn it into me and I'll hold on to it, but I would use it to answer those questions. So that should be pretty easy. Go ahead and knock that out. When you're done, try to turn it in.